Welcome to Dr. Dean's bonus video titled, Healthcare's Fatal Flaw is Back, Again. Our response to the COVID pandemic was an economic shutdown that caused more than 20 million Americans to lose their jobs. Since most workers have their health insurance paid by the employer, when they lose their jobs, they also lose their insurance. This is a fundamental flaw in the whole healthcare system. People no longer have health coverage just when they need it the most. The problem started in 1941 during the Second World War. To prevent inflation, the government imposed wartime controls of both prices and wages. Employers were prohibited from raising employees' salaries. Washington provided an alternative form of compensation. It allowed employers to use pre-tax dollars to pay for their workers' health insurance. Thus, there was no increase in wages. Employer-supported health insurance has continued for 75 years despite the end of the Second World War and the repeal of all those wage controls. Now, let's look at a family budget. In 2018, the average American family expended $28,166 on health care. 83% of that money went to insurance companies, and 67%, that is, two-thirds of it, was paid by the employer. When someone is fired, the employer stops paying for the insurance, and the suddenly unemployed individual joins the ranks of the uninsured individuals. Back in 1990s, there was an economic turndown similar to today, but not as severe. People were losing jobs, and thus they were losing their insurance. There was a big outcry, so Washington promised to fix the problem. Congress passed the Health Insurance Portability and Accountability Act of 1996. The P stood for portability, and people assumed they would be able to keep their health coverage when they lost a job while they were out searching for another one. That's not what happened. Skip ahead to today, 24 years later, and our COVID experience shows that people are still losing insurance when they get a pink slip. HIPAA did nothing to solve the problem. In reality, Washington uses the same approach for every problem. They build a new, bigger, more costly, and more intrusive bureaucracy, claiming that that will solve everything. Both HIPAA and the Affordable Care Act did expand regulations, administration, oversight, and spending. They did not do anything to help Americans get the care they need when they need it. There is a simple solution for the problem of losing your insurance, one that does not involve creation of a whole new federal bureaucracy. Simply break the link between employment and insurance. Give the employee extra wages and let the employee use pre-tax dollars to buy insurance in his or her own name without the employer involved at all. With this solution, even if you lose your job, you still have your health insurance policy. That's it. Problem solved without adding any more compliance officers or bureaucrats to the federal healthcare payroll and without spending one single dollar. For more on this subject, including how you can keep your health insurance, read Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine. If you have not already subscribed to the website We Can Fix Healthcare, check it out at deanwaldman.com. That's Dean with an E at the end. My mother did that to me 77 years ago. Just click on the blue blinking icon at the top right of the banner. There is no charge for any of my bonus materials. And encourage your friends, neighbors, and your colleagues to subscribe as well. Oh, and be sure to subscribe to my YouTube channel to view the latest videos or the ones you may have missed. Just click on my image to your right. Thank you for watching and for being part of the cure for our sick healthcare system.